Hello, my name is Joshua Sixon. I'm a second-year internal medicine resident at University of Miami JFK, here to discuss a case of acquired factor X deficiency in a patient with gastrointestinal amyloidosis. Introduction. Amyloidosis is a group of infiltrative disorders that has been known to be associated with numerous bleeding diatheses, including acquired von Willebrand disease, decreased coagulation factor synthesis in patients with advanced liver involvement, as well as acquired factor X deficiency. Factor X deficiency is a rare phenomenon. It may be either inherited or acquired. One proposed mechanism for factor X deficiency in amyloidosis involves binding of factor X to amyloid fibrils. The clinical features of this condition include bleeding, in some cases severe, prolonged PT and PTT, as well as severe factor X deficiency. Here we discuss a case of a patient with GI amyloidosis who developed factor X deficiency. The patient is a 76-year-old male with complicated past medical history, including aortic stenosis, status post mechanical valve replacement over 20 years ago on home enoxaparin, persistent atrial fibrillation, sustained monomorphic VTAC with AICD placement, intra-abdominal non-Hodgkin lymphoma, cecal amyloidosis, and multiple lower GI bleeds with small bowel resection, who presents with 3-day history of black stools, epigastric discomfort, and nausea. On a presentation, patient denied any vomiting, diarrhea, hematochezia, fever, or other constitutional symptoms. Patient's initial hemoglobin was 8.0, his PT was 15.9, and PTT was 43.5 seconds. A bleeding scan was done which showed bleeding in the left pelvis. EGD showed a 1.5 centimeter non-bleeding gastric ulcer, and colonoscopy showed ileocolic anastomosis with bloody mucosa. 2 clips were placed. Per multidisciplinary discussions with the GI team, primary team, and general surgery, anticoagulation was resumed cautiously given patient's medical history, and patient was monitored in the ICU. Patient's hemoglobin decreased over the next 24 hours, and patient received multiple units of packed red blood cells. A repeat colonoscopy was done, which showed copious blood at the anastomosis, and 2 more clips were deployed. Hematology-oncology was consulted, who proposed that the bleeding could be secondary to arteriovenous malformation from the mechanical valve replacement, known as Hyde syndrome, versus amyloidosis. Given the persistent bleeding, exploratory laparotomy was performed, and 2 feet of abnormal distal ileum was resected, which was characterized by diffuse mucosal hemorrhage and prominent mesenteric lymph nodes. From there, the patient developed further melena requiring blood transfusions and fresh frozen plasma, acute renal failure, and subsequent respiratory distress that required intubation. Further workup with discussion with hematology-oncology team included coagulation studies such as factor X, which was found to be low at 15%, normal range 50 to 150%. Patient initiated on dexamethasone, bortezomib, and cyclophosphamide to treat the underlying amyloidosis. However, patient deteriorated further and had episodes of sustained VTAC and ventricular fibrillation. Goals of care discussion had with the family, and patient transferred to hospice. Comfort measures initiated, and patient subsequently expired. In the center panel, we see the initial lab findings. Patient had an AKI with creatinine 1.7, baseline creatinine 1.2. He had an anemia and low platelets. We also see the factor X, which was low at 15. And in figure 1, we see the abdominal bleeding scan with SPECT images showing bleeding in the left pelvis involving the ileum. Discussion. Acquired factor X deficiency is a rare but life-threatening complication of amyloidosis, as some patients may only present with elevated PT and PTT. Prompt recognition of factor X deficiency is critical. Given the condition's rarity, information regarding treatment options is limited and acquired mostly from case reports. Previous options for treatment include fresh frozen plasma, which the patient received, and prothrombin concentrate. A factor X concentrate does exist, though available at select institutions. Another crucial treatment option would be treating the underlying disorder, in this patient's case, treatment of his amyloidosis. Overall, further research is required to better understand the proper treatment and long-term implications for patients with acquired factor X deficiency and amyloidosis. Thank you.